Chocola, Guatemala. It's a rural agricultural community with villages connected by rocky dirt roads and hand-made paver stones. It's a place unknown to a lot of people, even in Guatemala. A forgotten village that disappears like a speck on a map, and it's where Dr. Sergio Castillo chose to practice medicine.
Chocolá es una región eminentemente con las plantaciones de café y rodeadas de las comunidades más apartadas en el país, más alejadas de los servicios básicos, más alejadas de la educación, de la salud, de los accesos, del desarrollo, y a veces hasta la esperanza les queda lejos.
18 years ago, he sold everything he owned except for some clothes and a couple of cars. He left his practice in the city and took his family into Chocola to help the people that have a dire need for medicine. Dr. Castillo has built a hospital, 2 permanent clinics, 3 mobile clinics, and over the years has gained the trust of some of the most isolated Mayan communities in the mountains.
Doctor, ya bien uts, iskisik, sí, ya colik legua pa quina. Ya 40 legua.
He works to serve the people. Businessman and entrepreneur Guido Martinez has seen the effects Dr. Castillo has on the lives of his employees, their families, and the entire community.
No tanto mis empleados, sino el beneficio es tanto para ellos como para sus hijos y sus esposas. O sea que esto encadena un beneficio total.
Dr. Castillo dedicates a lot of his time to provide health care. He works with officials in the city to bring potable water to people. He's at one of the 2 clinics on weekends or by appointment. He runs the hospital. I asked him, how does he meet a balance between work and family?
Es uno de los retos más grandes que enfrentamos. Nos ayuda mucho que como familia tenemos definido que la prioridad es el hospital, porque de esa manera podemos ayudar a más gente que realmente lo necesita.
His decision nearly 20 years ago has become a family business and has had a great impact on Melissa, one of Castillo's 4 daughters. She wishes to follow in her father's footsteps and has plans to go to medical school. She can remember being involved at 7 years old, gaining experience and growing in this environment, helping her father provide health care.
Cuando era pequeña iba atrás de ellos al encamamiento, entonces ayudaba a la gente a tomar su medicina o a levantarse, ir al baño, pero ya poco a poco fui aprendiendo cómo hacer suturas, cómo atender emergencias, cómo ayudar a la gente del postoperatorio, trabajar en la farmacia.
Dr. Castillo's medical consultations are $2.50, and surgeries cost as little as $62. He provides these services for people that sometimes can't even afford those prices, and with the Mayan culture that would trade chickens, raccoons, and bananas to show their gratitude. There are economic challenges that his medical facilities constantly have to work through. They are challenges that I thought to myself, is the financial risk worth the man putting his family through, knowing that as a doctor, he can make a more stable life for his wife and children? Dr. Castillo has strong convictions in the Jesuit order, and he explained his view on the differences between risk and faith.
Pero lo sientes en el corazón y tu fe está puesta en Jesús y encaminas todas esas acciones y pasos y procesos con la seguridad que lo vas a conseguir. Mientras que si se ve sin ese concepto de cristianismo con números fríos, se ve como algo riesgoso y temerario.
There's a little bit of downtime when the rain is hard and the electricity goes out, and he and his family will get together and sometimes read. One time,
y leímos ahí un administrador famoso de la Universidad de Chicago que su consejo era que un buen administrador siempre debería tener el 50% de cerebro y el 50% de corazón. Uh-huh. Yo creo que perdí el cerebro hace mucho tiempo y me ha crecido el corazón. Y en eso Dios nos ha dado la gracia de poder caminar así.
He has followed his heart into Chocola. He has helped countless numbers of people and their families in health and education. People who have to work back-breaking jobs now have the option to seek medical care. There's a chance of drinkable tap water in the future. And maybe Dr. Castillo has brought the people in the villages of Chocola a little closer to hope.